Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Welcome back, everybody. We are talking about hernias right here on Healthy Living Tuesday on KUM. Thanks so much for watching, because Dr. Jitka Lom is here. She is the chief physician at ExpressCare. And, we started talking about the hernia cases that you've seen. You said you've treated some of them yourselves. How common are they on Guam with, our lifestyle and, even climate, if that has anything to do with it?
Not so much climate, but they're very common. And, this is a common thing that general surgeons will deal with. Yeah, very common.
People in your line of work, when you're giving physicals, either for students, for athletes, and everything like that, there's a procedure that you can do to very, very quickly determine if someone has a hernia.
Right.
How is that performed?
Well, we check, when we're doing a physical, we'll check your tummy, your abdomen, and then also we check in boys and young males, we'll check their groin area and the testicles, because when they cough or strain or just bear down, you can see if that testicle descends, and if it does, sometimes that's because the hernia is pushing down on top of it. Then that's for the sports hernia, that you were mentioning, so that you could pick that up and hopefully repair it before it gets worse.
This is the dreaded look to the right and cough twice for me test. And so something that every young man, it's a rite of passage, boys. So when you do it and you pass the test and everything, you are well on your way to becoming a man. Okay. Speaking of the other and the more superior gender, somebody asks, I heard women can get hernias as well, especially if they are overweight.
That's true. Women can get hernias. They tend to be different than men because they tend to be in the thigh, called a femoral hernia. This is not uncommon again in ladies. As far as umbilical hernias or surgical after surgery hernias, they can get those too on their C-section scar or any other scar that they might have on their tummy. Yeah,
I was going to ask how much pregnancy can that exacerbate an existing problem?
It definitely can.
Okay. What is the downtime when you have a hernia? Somebody asks. So not only for recovery, but maybe if you're feeling it and you do a job that requires you to have a certain level of physical exertion.
Right. So the recovery time after hernia surgery, you could be back to full activity probably in 6 weeks. That would be pretty safe. After a couple of weeks, you'd be back to a regular job, which would be walking around or sitting or standing, but not heavy lifting.
If you've got an office job when you're behind a computer, you should be okay. But if you're a construction foreman or a Navy SEAL, probably significantly longer.
6 weeks or so.
Okay, sounds very logical. How does poor nutrition, our next question asks, and smoking contribute to somebody getting hernias?
Well, poor nutrition affects our healing, and especially vitamin deficiencies and lack of proper minerals and vitamins. So I guess it could affect your healing time after hernia surgery. As far as does it cause a hernia, not really. Smoking makes everything worse as far as healing time. Also, I don't think either one of them though would contribute to the cause of a hernia.
Okay, but then again, you want to
recover well.
Yeah, and you want to treat your body.
You want to heal well.
Very well, and you want to live healthily. So don't smoke. Limit alcohol and watch
keep your weight.
Yeah, exactly. Yeah. Okay. Is there any way to treat a hernia at home that does not require surgery? Somebody asked this, and I guess this is one of the most poignant.
It is important. If you know that you have a hernia and it's bulging out, you can actually manually push it back in, and people do this at home without any advice. They just know to push on it and push it back in.
That's not risky?
No, usually not. It'll just, pops out and they push it back in. As long as it keeps being pushed back in, it's okay, but at some point it may not want to go back, especially when it's too big, and then that's when we get into the incarcerated part, or just it's very huge, and I mean, it's very uncomfortable for people when they've got a very heavy, large thing, either in that lower groin area or wherever. So it can be quite unpleasant for them to have a large hernia.
Well, how large is large? Because you said like a large
it can
growth or some sort of distended.
It can be quite large, like the size of a grapefruit. Yeah, or if it's in an incision, meaning they had a previous surgery and now that hernia is pushing out through that, it can be really, really very uncomfortable, very big. And so you want to deal with your hernias when they're small. The incision will be smaller, the recovery will be easier, and you'll just have an easier time. So it'll be on your time, not when it's an emergency.
Okay, well, we are going to end this interview. We're going to cycle back to the initial anecdote I gave about, lifting manhole covers, which
Yeah.
nobody should do anyway, because, I don't know why. And that was an old Bill Cosby gag about, I can miss 2 weeks of school by just lifting a manhole cover and, giving myself a hernia. I don't know why Bill did that. But what is the proper way to lift so that you can avoid even having to deal with that situation?
Great question. So, when you lift, you should keep your spine straight. That's really the most important rule. That means bend your knees, try to look ahead rather than looking down. Look to where you're placing the object rather than looking at the object when you're lifting it. And then, so keeping your spine straight, bending your knees, and the third thing, moving your feet to move your body rather than twisting your body. When people lift and twist, that's when they get into trouble, because they'll strain something and get hurt.
And get one of those back braces like the good guys over at Costulas have.
Sometimes.
There's a reason why they wear that. It does help. All right, Doc, thanks so much as always.
Thank you very much. It's my pleasure.
Information was greatly appreciated.
Thank you.
All right, stay tuned. We are back right after this. More healthy living when we return.